I was working in an inner city hospital in the Boston area, and in the emergency room. It was a hectic night, and a patient came in who was known to me. He was one of our so-called frequent flyers. There was some kind of a domestic situation at home. He was a patient with a tracheostomy. Apparently he was having some difficulty breathing, so EMS brought him in. We put him in our last available bed. All of the poles were taken. You know, there were patients in the hallways, and it was just one of those really tough evenings. I brought him in, was doing the initial assessment. I greeted him, he recognized me, and we talked very briefly, and I was putting the blood pressure cuff on him, and he made a request that I call his wife. And I said, let me just get you settled and check your blood pressure and make sure you're breathing all right, and I'll be happy to call your wife. And within a second, he just changed. He lashed out at me. He, with the back of his hand, he fisted his hand, and with the back, his hand lashed out, and it got me in the cheek, and the force of it smashed me up against the wall. I went down. I immediately called for help, and help was in the room so quickly, and the patient was now off of the bed. He had jumped off of the stretcher and had backed himself into the corner of a room and was banging himself on the chest, smashing himself in his head. He was just crazy, incensed, pointing his finger at me, accusing me of, not doing what he wanted me to do. He was just completely out of control. It took about 8 people, combination of the EMS drivers who were there, 1 or 2 physicians, several nurses. The security team came in. They finally got him down, and at this point, nobody even realized that I had been hit. And the charge nurse at the time turned around, and once we had him settled, and she said, "Are you okay now?" And sort of dismissed everyone. And I said, "Well, he hit me." And she said, "Oh my gosh," looked at me and realized that my face was red and swollen. So immediately I was taken out of the room, and now I became the patient. I was completely stunned. Never ever expected to be assaulted at work. I think that was the biggest shock of all. Initially, my concern was for the patient. The whole time, now I was a patient, and one of our, terrific, one of my colleagues was now taking care of me, and I kept asking her, "How is he? What's going on with him?" And, she had to really redirect my thinking and say, "Look, we're now going to take care of you. Your face is red, and, we need to take care of you." My husband was called. He came in, obviously was quite incensed when he heard what happened. Days went on, and still I was stunned. I never ever expected to go to work as a nurse. Yes, we are working in an emergency department, and we see everything. All the intoxicated patients, and the patients who are upset about not having to wait and not getting the treatment that they want, and we deal with that on a day-to-day basis. But being hit, never had any inkling that would happen to me. I spent 5 months out of work recuperating. I was physically injured, but also emotionally and psychologically injured. Had a lot of post-traumatic stress, and still do. I returned to work, and not in the emergency department. I was working on another floor, and I worked 3 shifts, and I realized I just couldn't do it anymore. Every time I would pull the privacy curtain during those 3 shifts, I would break out into a cold sweat, and I would have heart palpitations. The fear that a patient was going to, lash out at me again and just, take control the way that guy did, was overwhelming. So it has changed the way I work now as a nurse.